Hi, I'm Dr. Joe Sobucki of Sobucki Physical Therapy. I just had a great conversation with Matt Rosenthal about losing fat and training the heart rate zone 2. We dig into zone 2, and if you want to learn how to lose fat and all about zone 2 training, watch this episode.
Today we have a two-time guest. This is the second time that we've had Dr. Joe Sobucki on the show. And today's show, you got to stick around to the end because what he's going to talk about is how to get into zone 2 cardio, how to get into that zone 2, and how to use that to maximize fat loss. Right? This is a secret. He's gonna tell you the secret. So welcome to the show. Thanks for coming back.
Thank you. Yes, it's a pleasure. I love doing these. I like educating people, my clients, and general population. So yeah, today we're going to be talking about the heart rate training zones and specifically zone 2, which has gotten a lot of rave. It's almost as famous as some of the other like hit names out there as Piriformis and Sciatica type things.
Before we get into it,
yeah,
anybody who's watching this, they're going to be thinking, well, why should I listen to this guy, Dr. Joe Sobucki? Just give us a quick background, who you are, what makes you an expert on this matter?
Yeah, so I'm Dr. Joe Sobucki, and I'm a physical therapist. I'm on practice, Sobucki Physical Therapy in Boca Raton, Florida. And with respect to heart rate training, something I've done myself, something that I educate my patients on with bettering themselves post-care, but also preventative measures as well. There's some training athletes that I see as well. And with respect to trying to increase metabolic rate and then just improve their overall general health. And these are things that are important to reduce the risk of injury as well as just live a little bit healthier cardiovascularly and live a little bit longer as well.
You work with professional athletes.
Yep.
In fact, I met you through a mutual friend on the show once, as I said. And as a result, I began coming here to IHP in Boca Raton, and being here, I turned to you one day and I'm like, who are all these people training here? And you're like, oh, they're all UFC fighters, MMA fighters. And little by little, I've come to know some of them. We just interviewed Dustin Lampros on the show today, and Charles Roast is going to be on. You positioning yourself where your office is here at IHP, right? We're sitting here on location IHP. How has that given you maybe a leg up or maybe an advantage or maybe a perspective into what it is that athletes actually go through? I know you treat athletes, but you're actually in a facility where you're seeing them train all day.
Yeah.
Does that have an impact on your perspective?
Also being an athlete myself, I think has allowed me to get an inside view of what it takes and what is needed to reach those levels of training. Played college football and I was a slot receiver and I was running most of the day. And now seeing some of these guys training in a similar fashion with respect to intensity, but now also to where they're going to be doing things that are functional pertaining their profession, because that's what they do for a living, to where they're going in between different positions and different striking between kicks and punches and grappling and takedowns. And also like that Versa climber, which is, I think, the worst thing ever invented. But then going,
we save that for last.
Yeah, we save that for last.
I can't walk after that. It's like I'm about to pass out and throw up. Thank you.
Yeah, you're welcome. And then do that intentionally. And then also the sled as well, and just trying to push that threshold even further. And that's going to be way beyond zone 2, right? Going into that intensity level is what is beneficial to increase how big your zone 2 is, but also amplify the effects of being in that zone as well. And being in this position, I got lucky coming into IHP and being able to fall into working with more professional athletes, because I've worked with NFL players, professional tennis players, professional golf players, and now the fighting crew, which are honestly some of the nicest guys I've ever met.
Which, whole different breed of training, though.
Absolutely.
What goes on here is like,
and they're doing anything pertinent to what their fights are. So if you have somebody fighting in a championship fight, it's 5-minute rounds, and they'll train 5-minute rounds with minute breaks, and they're really getting that intensity to allow them to feel what it's going to be like when they enter that ring. And the better that they can do that, it's almost like running with a parachute on. You're going to be able to run faster after.
All right. Zone 2.
Yes.
I discovered it because I saw a video and it got my attention, because like everybody, it's like you want to train and you want to lose some fat that just builds some muscle. So when I discovered it, I was like, whoa, like, I don't know how I missed this in the past 30 years. And so I did a bunch of research, and I said, well, I know a guy that can talk about it. So let's do our own show on it.
Yeah.
So we're talking to people out there that are going to find this video. They're going to watch it, and they're going to say, what is zone 2? How long should I be in it? How does it work?
Yeah.
Let's just go through it slowly. So first of all, what is zone 2? Well, there's 5 zones.
Yeah.
Maybe just very briefly the 5 zones, but why zone 2?
So why zone 2? So if we look at, there's 5, sometimes we can categorize a 6th one in there, which would be the like lowest or the highest state actually of like an all-out max effort. But looking at zone 2, that's when you bypass zone 1, you hit that first lactate threshold, as I marked up there, LT1. And that's when your slow twitch muscle fibers are working. It's very easy. Say just like a light walk to where you can have a full conversation, or like lightly even like cleaning the house or something like that.
That's zone 1.
That's zone 1.
Like your heart rate is a little elevated.
We have something that's very easy going on, just working slow twitch muscle fibers. And it's the mitochondria within that skeletal muscle that is actually burning fat. But zone 1's not a very effective area to do that. And that's around 55 to 65% of your heart rate max, which we'll get to later. And then from 65 to about 75% is that sweet zone, that zone 2, which has been proven to increase the amount of what's called lipolysis, which is when your body is oxidizing fats or fatty acids or lipids to give you energy to start to produce force to whatever exercise you're doing. Cycling or an incline treadmill walk, or even like a light jog, potentially, depending on how trained you are. And that's that zone that you have max fat oxidization to where we're using stored fats as energy.
So there's a science to it. I mean, it isn't like this is somebody's opinion or it's some fad. I mean, zone 2, this is the science. You're going to take us to the science. It's real. And if somebody understands how to get in that zone, stay in that zone for long enough, they can actually focus more on that fat loss.
Yeah.
But it's not going to be overnight.
Yeah.
It takes time. It could be months.
It could be, yeah. And that's one of the biggest words, is the C word, it's consistency, that I teach everybody. But I also tell patients that fear is the lack of knowledge, right? Somebody's afraid to start training or to start their journey into weight loss or any type of training when they don't know. But as you can educate somebody, it empowers them to start that journey. And we start to look into these zones, and if they can enable themselves to know about them, we'll see more and more, hopefully, of the people around starting to do that and going into that. With the science behind it. So what we'll see as you start to get into that zone 2 level, like I was saying, we're still using glucose, which is called glycolysis. So you're oxidizing sugars as well, carbohydrates, and also lipids or lipolysis. But at a higher level, you're using your lipids, your fats, your fatty acids, and at a lower level, using glycolysis, because we're still using slow twitch muscle fibers. And each of those 2 are substrates or energy for the mitochondria, for those muscle cells to produce force. As we start to ramp up the amount of intensity, which is directly correlated to your heart rate zones, that's when we start to see the byproducts more kind of with lactate and other byproducts. That's how we can start to tell what zone we're in. As you start to get into an area, if you were on that Airdyne bike, right, how we will warm up, you get to that point where you can still carry on a conversation, but it can start to get difficult, but you're not taking intermittent pauses for breaths. We're probably closer to the end of the cusp of zone 2.
Right.
So just below that, anywhere between that and then where it feels too easy, somewhere in between that zone 2 level, right, which is going to be the max oxidization for fats. That's where we're going to be burning it. But with respect to that, we don't want to bypass that. It's hard to come back in gears. So as soon as we start to bypass that, that's when we start to see that arrow start to work upwards in that red zone, which is anywhere from zone 3 to zone 5 or 6. And when we can stay in that orange zone, is typically how people color it, that's when you're going to be getting those fat burning effects.
Now, I've set my watch up to do it.
Yeah.
And I figured it out by going online and Googling how to set my Apple Watch up to do it. It's actually easy 3 steps. But it's interesting when I'm on the treadmill. So I'll get on the treadmill and go maybe like for me, like a 6 incline, like 3 miles an hour. That's what it takes for me to get to my heart rate for zone 2.
Yeah.
And then I just stay there. And I stay there for like an hour. It's like you said, it's not that hard.
Yeah.
What I do notice is, though, that if I'm not paying attention, I could easily just go a little too high, or I could easily just go a little too low. So it is important that you use a watch or a
heart rate monitor,
chest monitors. Yeah. Can you rely on the ones that are like built right into the machines?
They might not be as accurate as some of the ones that are worn. You have a longer extremity.
Right.
Instead of going through and checking the heart rate touch through here, it's got to go through like fat and go through the other side. So we have a longer band, right? It'll be somewhat accurate. And you can kind of rely on it. It's not that you have to be pinpoint accurate, but as long as you're within a range, and it's more important to know your range rather than know a specific heart rate. One of the best ways to test that is not really the heart rate 220 minus your age. That's a difficult one to go off of. You want to try to find somebody that can either do a blood gas test while doing a stress test, or like VO2 max testing, where they can actually see once your threshold is actually bypassing, to where we know when you go past lactate threshold 1, and then once you pass lactate threshold 2, and like a VO2 max test is an incline treadmill test where you start off walking, the speed increases, the incline increases as you slowly go along, and it makes it more and more difficult. It's a submaximal test so that you don't pass out, fall off the treadmill. But that allows the testers to see the subject's blood gases that are coming in. So they'll have a face mask on.
I see
with a monitor. Yeah. And they can check your blood gases. So they can indirectly measure your lactate levels based on fatigue, based on the amount of oxygen that you're consuming and using to oxidize either fats or the glucose, right? So we have lipolysis or glycolysis. We want to be where max lipolysis or fat acids are being burned.
So for most of us, though,
yes,
we have to rely on the watch.
Yeah.
And it's reliable.
Their watch is reliable.
With that range?
Yeah, Apple Watches.
Can you take us into the range?
Yeah. So the range is, like I was saying, we have 1 through 5 typically. This would be an all-out max effort once we can't even use glucose anymore.
Well, you have like 1 through 5 are your zones.
Yes.
Okay.
So we have a recovery zone. This would be like the days that you're really like, if you'd worked out hard the like 2 previous days and we're just trying to get blood flowing.
Yeah.
We'd want to either hit that or even to zone 2, but zone 1 primarily. That way we can get
I'm gonna write while you're talking.
Yeah. That way,
use me as an example.
Yeah.
So I'm 51 years old. If we had to use basic math, I don't want to stand up and mess up the cameras here. All right. So I'm 51. So
169 would be your.
I'm not gonna do the math, but I still have to do 220 minus my age. You said that's 1. So we'll round it to 170.
Yeah.
Okay. So with that 170, if I want to be in zone 1, which I don't want to be in, I would just multiply that by like those 2 numbers.
Yeah. So we could take 0.65 or 0.75.
So you get into zone 2.
Yeah. For zone 2, that's our bare sweet spot. So we can just
get my calculator.
Yeah. We can take the percentages and then multiply that by that heart rate zone.
Okay. So for zone 2, I'm going to be 170 times,
let's say 0.7.
Where am I? So I want the range though. So I'm at 0.65. So I'm from 110. Where my marker go? I'm from 110 on the low end. Like basic math, right?
Yeah. Percentages.
This is like 3rd grade math.
I was just using
my calculator. Times 0.75, right?
Approximately what?
Okay.
120
to 127.
Yeah.
So it's funny because when I go on the treadmill and I'm doing what I said, it usually keeps me right around 115.
Look at
that. That got me there. So am I too close to that, or should I be more at the high end of that to be in that zone optimally?
If you could get closer to what your actual range is,
work harder there.
And you'll actually see a little bit more benefit being closer to 120 or 125 rather than 110. Okay. And the longer that you can stay there.
So that's my zone 2.
Yes.
Okay. How long should I be in that zone 2 for it to have an effect?
Yeah.
Is a half hour enough?
A half hour would be awesome. So recommended through the American College of Sports Medicine is 150 minutes per week. So if you can do that, if you do zone 2 training for 30 minutes, 5 days a week, you're going to be doing.
You're going to burn some fat.
Yeah. If you can go longer than that, you're not doing anything harmful to yourself. You're only benefiting more.
And in that zone, you're burning fat. You said it's because of the way your body's using. You said lipids.
Yes, your fats, your fatty acids are lipids. Yep.
Right.
And then primarily that you will still use glucose or stored carbohydrates. So another really big benefit too is if you do fasted cardiovascular at zone 2 as well. So you have less carbohydrates inside of your body. So if you get up in the morning and you haven't eaten since 7 o'clock or 8 o'clock at night, and it's 8 o'clock or 7 o'clock in the morning, we've had 12 hours of fasting to where now anything that's was in our like digestive system is
like
pretty much going to be gone.
Right.
Yeah. Your body used that throughout the night while you're resting and sleeping for recovery. And now what we'll see is we can actually attack more fat cells by way of being in that zone 2 training.
Now, so if I'm in that I'll do that for an hour.
Yeah. If
I'm in that for an hour,
that's awesome.
5 days a week.
Yeah. That's 2 thumbs up.
What should I expect?
What you should.
Am I going to all of a sudden, like, is this the big secret? Like in a week, I'll lose 5 pounds of fat?
That might be a little excessive. It depends on where you're at, though. I think it's person specific, but you might be surprised sometimes. Even some water weight as well might drop off, but throughout 2, 3, 4, 6 weeks, like we'll start to see that drop. And at the same time, as you're losing fat, you'll start to build some muscle in the legs. But at the same time, too, your metabolism is going to go up because this is your metabolic rate essentially. And the more that it's trained, just like how guys that like big muscles, they train with big weights, we can train that zone 2 zone longer and a little bit more intensely. It's also good to sometimes push into those other zones, those higher ones, to increase that threshold as well. But yeah, if you can be there an hour each day, 5 days a week, you'll start to see fat loss. You'll start to see cardiovascular health go up. You'll start to see your metabolism increase to where you can I won't say you can eat anything, but it won't affect you as much.
So some people could look at this and say, well, this is so simple. Why isn't everybody doing it? Or why is it like a secret? Or why isn't it like people will run a distance or get on the treadmill and run? Or they'll get on these really intense workouts, which I guess would be like a zone 4.
Yeah, would be
4. I mean, even 5. And you and I have done some crazy workouts here where I'm literally at 100% of my max almost the entire time, and I could barely even think. That's not burning fat. I'm doing that for a different reason. What's the difference?
That is to increase that zone 2 threshold so that your lactate threshold number 2 can actually be advanced a little bit more to where you can actually extend it a little bit longer, but it's easier for you to reach that range. And it's going to be more effective to where you'll start to burn less glucose and more fat. So as that range gets trained a little bit more by being in zone 2, but also doing some of the stuff that we do that's higher intensity, we're starting to stress ourselves out. And that's actually what the fighters, JC actually always talks about, JC Santana, that trains a lot of the fighters here. He talks about some of the guys that come in for their first camp that have never trained like that before, and they can't make it through their first 3-minute round and they're puking. And then 3 weeks later, they can go through the 3-minute rounds with a minute break in between each, and they can go through that twice. And a lot of it is mental, and that's where a lot of people will kind of get into a block, and they don't want to pass that threshold because it's uncomfortable. But if you can mentally start to calm that down, especially with some of the training that they do, you can start to push into these accumulations of cardiovascular health and the ability to maintain a longer endurance, especially when you're doing something as vigorous as fighting.
So when you're out of zone 2 and you're doing the kind of stuff we're talking about, you're not like zone 2. You're going to burn primarily fat.
Yes.
You're not burning primarily fat when you're in zone 4 and zone 5. Nope. What are you burning?
So as soon as you start to bypass zone 2 and we start to get into zone 3 and your heart rate increases a little bit more, what starts to occur is the slow twitch muscle fibers are starting to allow the fast twitch muscle fibers in your skeletal muscle to work more effectively because you have to typically produce more force. That's then going to be glucose use or your carbohydrates, your stored energy, or what you have eaten. And what occurs there is glycolysis. So the lipids start to shut down a little bit, and now we're starting to use the sugars as energy because they're more beneficial. It's like jet fuel almost versus what is it, 85 regular.
So your body needs different fuel when you're working out like that. Like the fat's not going to do it.
It has to change metabolic.
Do you remember I came here one day and I used to do intermittent fasting?
Yes.
I came here one day and I didn't eat.
The first day.
It was early on. And I was like, I can remember almost, that was the first time ever working out here with you that I actually felt like I was going to pass out.
Yeah.
And then you actually explained to me, like, just give it a sec, that'll pass.
Yeah.
You're not going to pass out, and you were right. Now I've gotten used to it.
Yeah.
But like 3 or 4 times that day, I was like almost like about to pass out.
Yeah.
And you were like, I told you, you got to eat before you come here.
That too. Yeah.
Right?
That helps.
But I didn't know why.
Yeah.
And I never did that again. And I would never do that again.
Yeah.
Like, it was one of these workouts.
Training at these intensity levels, you definitely want to have something in you. You need the carbohydrates.
Yeah.
If you're doing zone 2, you're perfectly fine without those carbohydrates. You'll benefit having maybe a banana or something.
Yeah.
You can do it fasted. If you're going to be doing the Versa Climber, sled pushes, rows, things like that, to where you're bumping your heart rate up, you're going to need those sugars in you.
Let's get back for a sec to the diet, right? So, okay, I'm doing zone 2 5 days a week. And I don't know, maybe I lost a pound or something. I mean, for me, I'm little, so it's not like there's a lot of weight to lose.
Yeah.
So does that mean I can eat whatever I want? Like, is that an excuse to be like, oh, okay, well, I'm doing this, so ice cream and pizza?
If you're 17, 18, you're playing football in college and you're training twice a day, maybe. But for the general population, I would say that still having a balanced like diet to where you're getting your meats, your dairy, like your vegetables, your fruits, things like that would be beneficial. It really comes down a little bit more importantly to your caloric intake versus your caloric output. So if you're taking in 4,000 calories and you work your butt off during the day and you're burning 2,000, we're still at a caloric intake, right?
Right.
So we're at a surplus, and some of that will still get burned off at night as well. But yeah, I wouldn't say that you can eat whatever you want, but it would be important to still eat healthily.
And that's the point. This isn't like, it is a secret in a way because nobody talks about it.
Yeah.
And when you discover it, it's like, oh, if I eat healthy and I live a healthy lifestyle and I'm lifting weights, going to the gym, if I add this in, all of a sudden I'm going to kick in some fat loss that maybe I've been struggling with for a while. And that's kind of like the secret that isn't such a secret, but nobody talks about it.
Yeah. It's just not as mainstream as hanging out at home or going out or eating pizza and wings every Sunday, watching football, you know.
What about these people that we see like running on the treadmill for like an hour because they're trying to burn some fat? They're not doing it for cardio. They're trying to lose weight. Why wouldn't they just get on the treadmill and walk and be in the zone 2? They don't know.
And that's the thing, is it's almost kind of opposite of that.
It's counterintuitive.
They think that they need to run at a high intensity to burn fat, when in reality it's very anaerobic. We're actually in these zones here to where we're burning glucose.
Right? We're
burning sugars. We're not burning fat.
Primarily, you're not burning fat in that zone.
If you start to ramp that down, actually it's harder to kind of come back from that. So like slow down. But if you only train at the zone 2 range and do that for 30 minutes and then go into an intense run, that would be much more beneficial. Now you're getting the fat burning effects, and then you can start to cardiovascularly train.
It's a tough workout.
The heart muscles. Oh yeah, that's a killer. Yeah. But that'll allow you to get the fat burning effects initially, and then go into it a little bit more like profusely with. You're going to be really working leg muscles as well as your cardiac tissue, which is it's not a skeletal muscle, but it's still smooth muscle. And that's what will give you a more efficient heart pump. And that's why you see all these trained athletes where they have a VO2 max that's exceeding 55 and their resting heart rate's around 50 beats per minute, because their heart's that efficient and their arteries can put blood to their extremities much more easily.
And if somebody might say, well, I see all these runners that are super thin, they don't have any body fat. Is that more because they're running for so long? They're just burning a lot of calories.
They're burning anything they have.
It isn't that this is going on. It isn't that they're in zone 2, or it isn't even that the zone is the issue. They're just running so long for so frequently that they're just burning a lot of calories. That isn't just burning fat. That's also, you're losing muscle, aren't you?
You might lose muscle
also
so much.
Thin, the long distance runners.
It would depend on what you're intaking during the day.
Yeah.
But a lot of those runners too, they'll run and train so long that they'll even have glucose packs with them. like on like a little like baggie. You might even
Yeah.
see like cyclists, just to give you energy so that your muscle can keep going. But you have to also think how long it's taken them to train to that area, like, and their thresholds are extended here. Really, their zone 2 very well could be at a higher percentage base of their heart rate max.
Oh, that's right. That's right.
So that's why the 220 factor is a good starting point for somebody that wants to get into zone 2 training. And then I like the talk tests. So like we should be able to still have a conversation like this, even though it might get a little heavier breathing.
Yeah. That's a great way to judge it.
I shouldn't have to talk and hold my breath and
like hold on to it really.
Yeah. Or stop and like take my feet off the treadmill or anything like that. But the talk test is a good way for general population if you don't know of anybody or can't afford to go and see somebody who can do a VO2 max test or do blood gas, like see where you're at to see what your actual zone 2 is.
I just thought of something while you were talking because is there an eraser?
Yeah.
Right, this thing right here. There's also something I didn't ask you about, which I wasn't going to ask you about, but we need to talk about it.
Yeah.
Right? So it's steady state is what we're talking about versus interval.
Yes.
If you're doing interval training, which so many people go to the gym and press the button for interval, and it's like it gets harder, easier, harder.
Yeah.
You're not staying in a zone. You're all over the place.
Yeah.
We're talking about steady state is zone 2 for 30 minutes, hour.
Yeah.
Put Netflix on and watch a show for an hour.
Yeah.
You got to be in the zone. You can't be all over the place, right?
Digging in with Matt Rosenthal.
That's right. Throw my chef, right? But you can't be doing those interval training programs because that's not what we're talking about.
If you go in with the mindset and you know which one you should choose for which reasoning, if you're trying for fat loss, steady state's going to be the best. If you want to push that threshold and you know this isn't a day where I'm setting a goal for fat loss, I'm more or less, I want to extend my threshold and make my body more efficient at burning each type of the substrates, the glucose and the fatty acids. Interval training will help with that. And that'll help extend those a little bit. That'll make your body a little bit more efficient at burning those substrates.
I mean, you're building, with interval, you're building that cardio.
Yep.
I mean, in layman's terms, you're doing the cardio, like you're increasing your capacities and your limitations, and it's super healthy.
Yes.
But that's not about fat burning.
And that's not fat burning.
Yeah.
That's
the myth.
Then that's the myth that people think that the harder I work, the more I push, the more fat I'll lose, which isn't in reality.
Because nobody can see, but there's somebody behind the camera.
Yeah.
Who's going,
Yeah. It's really funny. So you have what's called thermogenesis. It's your body's ability to produce heat. Thermogenesis, right? Creation is genesis. Thermos, heat. Heat creation is in your body, and it's at these low level states like I was talking about earlier. Like if you're cleaning your house and you're nonstop going, like you'll start working up sweat, or maybe even like helping like move furniture around the house for a while, or going for a longer walk or on an incline. You're going to be just superseding or at the end range of that zone 1. So think of like a car. If you have a standard and like everything starts to get up to like 6,000-7,000 RPM, and it's like, I need to shift, and then you shift into zone 2.
Yeah.
Right. That's when you start to hit that zone.
That's a great analogy.
But if we start to get into gear 3 and gear 4, gear 5, it's really hard to kind of come back and go into that zone 2. So interval training, you have to have the mindset and knowledge that you're going into exceed and push these thresholds and train them. We're not going in for fat loss. And that's where a lot of the confusion lies.
So for most people who are habitual, used to going in the gym, hopping on a Stairmaster, the treadmill, hitting the button, the best way for them to start, right, if they take what we're saying and they even do more research and confirm that this is true, this is real stuff, this is science-based, you're not making anything up here, this is like pretty widely known in the scientific circles, they have to break a habit. Stop hitting the interval training thing, stop hitting the hills program, and either get on a treadmill, get on a bike, get on even a rower, which is probably more difficult to stay in that steady state.
Yeah, the rower would be difficult.
Be aware of where you are.
Yes, the awareness is one of the biggest things, and I always have patients that ask me, they're like, what can I do? And I always use parameters. I'm like, you can do anything as long as it doesn't hurt And if you do feel some discomfort, if it stays below a 3 or a 4 out of 10, we're just stressing tissue. If you start to feel that it's a 5, 6, 7, 8, 9 out of 10, we're probably irritating the tissue and causing damage.
Yeah.
I don't want to give you a long list of things not to do or what to do. But if you can stay within those parameters, the rowing would be kind of difficult. But there are different exercises that you can do that will keep you in that zone 2 range.
The simplest thing that costs nothing is to just go walk.
Yeah.
So I try to go outside and walk at times because I don't feel like going to the gym. It's nice outside. It is hard to get into zone 2 when you're going for a regular walk. So I find that I have to walk as fast as I can walk, and I have to swing my arms.
Jogging, yeah.
And I noticed that when I start going swinging my arms, I get from like a 108. And I erased it. I get myself up to the 115, but it's not unless I'm swinging my arms.
Yeah.
I don't mean like, Richard Simmons.
Yeah, but you're moving.
I'm actually moving
like a walking club.
And that adds an extra 5 or 6, I guess, heartbeats a minute. And then once I'm there, I can feel it. And you're right, you can feel you're there and then just have to think about staying there. If I slow down even a little bit, it goes right down to like 105 and I'm back in zone 1.
Yep.
And these watches tell you how long you've been, been in the zone.
Yeah.
And I'll notice that I'll be walking for an hour and I'll see I'm only in the zone for 50 minutes because a few times I just slow down just a little bit.
Yeah.
So it is easier to go on a treadmill because on a treadmill, you're guaranteed to stay at the same speed.
Yeah.
But you can just go outside and walk. It doesn't cost anything.
Yeah. That's one really big thing that I kind of chose these colors specifically, just like green people normally associate with like, okay, that's easy. Orange is like, okay, we're getting there. Red is like, hey, we're working hard. Orange Theory Fitness actually uses the same parameters, right?
Oh.
So they get you up to your base. You'll start in gray whenever you walk in, like your name will be popped up. You have a heart rate monitor on and it shows you that you're in this zone. And we start to get up into that base level, which they say is about here. They'll go and exceed a little bit more for what they're calling splat points. That's the target zone that they want. And that's kind of pushing that threshold a little bit. Whenever I would go in there, I'm obviously down here because I like to kill myself when I'm doing those exercises. I like to see how many splat points I can get, which anything above this is there. But they'll use that parameter too, to where you're in a zone and it'll show your heart rate max and it'll show your heart rate on there and everything like that, which is really nice. But yeah, even walking, I mean, in Florida, it's a little bit more difficult. Like you said, you have to kind of start walking faster. But if you look anywhere else in the country where there's some slight elevation or a bridge, if you have any bridges near you, that actually you'd be surprised how much more that could get you up into that zone.
Just to get out of the zone 2 for 1 second, we were talking about what goes on here and the training that we were doing for a while together, right? So if you recall, I was here to see you because I had a pain in my knee or my shoulder or something. Yeah. And I was sitting in your office and I was like, what is going on out here?
Yeah.
Who are all these guys? Where am I?
Yeah.
And you're like, oh, they're all UFC fighters and MMA guys. And I was like, what? And then you're like, oh no, this is like the #1 gym in the country for like conditioning training for these fighters. And I said to you, do you train? Because you're a physical therapist and doctor of physical therapy. I'm like, but do you train? Can you train me? I want to do that.
Yeah.
That was how you and I started doing it because I was like, wow, that would be a challenge. It would be something new. And we did it for, I don't know, 6 months or a year. It was a while until I got COVID. And it was very hard for me after that.
Yeah.
But it took me, I don't know, a couple months. And little by little by little, you were putting me through basically the same program that you mentioned, JC Santana, who's the owner here, who trains these fighters. And watching where they get to.
Yeah.
I mean, I wasn't at that level, but
you were doing,
for a normal human being, I was getting to a level. And the point is that if somebody really wants to challenge themselves and have a good time and just like kind of see what you're capable of, that zone 5 is like a fun place to go.
Yeah. Yeah.
If you don't mind like borderline almost passing out.
Yeah.
But even that, it's a weird high.
Yeah.
You get used to like, oh my God, I'm about to almost pass out. And then you're like, wait, I'm not going to pass out. It's like a sense of interesting reaching capabilities you didn't know you had.
Yeah. You kind of get that tingling in your body too.
But
that's a zone where, again, we're trying to push the envelope a little bit. We're trying to get our cardiovascular health expanded. Like I told you the other day when we were training actually at Orange Theory, I could get my heart rate up to 215 beats per minute.
You told me that.
And while I was doing the water rowing, which is only 5 below the
You're also half my age.
Right? I'm 30.
Yeah. I'm not 60.
But I was able to handle that capacity, right? But that's from years and years of training for track, football, baseball, basketball, where you're running all the time and you're cutting and you're pushing other guys and things like that. But a lot of people never really truly get to that area or stay in that area long enough to expand their capacity to handle it.
You can touch it, but to stay there. I remember one day we were sitting here and I looked at my watch and I was at like 176.
Yeah.
And I said to you, I think I should be dead. I mean, how's that even possible?
Yeah.
It's above my 100% of my max.
Yeah.
Which I've said to you a few times.
Yeah.
And you're always like, I think it's the point of my max was getting higher.
Bigger. Yeah.
It was getting higher. Mm-hmm. And then I would leave here, and after a period of time, I would notice that like at the gym, I wouldn't get tired. Like, or I would feel my capacity was way greater over a period of time. It was way greater.
Yeah.
And we stopped doing it. It's, I guess I had COVID, and then it took me a while. I never really got back to it. And now that I'm focused on zone 2, I don't really go back to it at all.
Yeah.
I kind of like being in zone 2.
Yeah.
Because that's hard too. I mean, look, these guys here are training for fights.
Yeah.
That is hard to do it consistently. I mean, it was taking a toll on my body.
Yeah. That's training for their job. That's training for life, right? That's where a lot of longevity will start to come in. And that's when you'll start to notice the cardiovascular benefits. You'll notice fat loss, and not just subcutaneous or underneath the skin, but intra-abdominal fat loss as well.
Which is super hard.
Which
that's
is
what everybody wants.
That's the killer.
What did you call it?
Intra-abdominal. So it's inside of your abdomen. It's not the loose skin that you have on your stomach.
It's even in between your organs.
But it's in between the organs, yeah.
And
that can make it difficult for those organs to receive blood supply, but also act properly, right? And if they can't function properly, that then puts you at a higher risk for either indigestion or cardiovascular attacks.
So many things. And you know, it's interesting because there's a test you can do, which is just go like this.
Yeah.
Right. And if you got a lot of abdominal fat, it is indicative that you could have other problems, heart problems, fatty liver, gallbladder problems.
It's a little less, I would say the test wouldn't be so much grabbing here, but if you have a dense, bigger, think like the beer gut, like everybody just think beer gut, right? There's people like
protruding out a little.
Not a lot of subcutaneous or fat underneath the skin, but they have a very big stomach.
Yeah.
And that's more of the test. And it's like dense, and it's not under the skin. You could just be pinching skin and not fat, but it's underneath your abdominal muscles and inside of the cavity where your organs reside. And it's literally around those organs.
I mean, that's just like, go to a medical doctor because you should find out about that.
Yeah.
But first of all, somebody who's got that definitely should go to a doctor and should talk to a doctor before you're messing around with like zone 3, 4, or 5.
Yeah, they don't want that.
And your doctor probably will tell you should get on a treadmill and just start walking, get in zone 1, zone 2, because it's just activity.
Yeah.
But now you're talking diet. Like that, they really need to get some guidance and maybe change their lifestyle and change their mindset.
Yeah.
But I just kind of thinking back to how I discovered what was going on here. And experiencing that zone 5 for like months and months and months and months and months with you,
you've even experienced zone 6 before.
Maybe I'm in the wrong zone.
No. Zone 5 is what you're thinking of.
Because zone 6 is where I almost like go down.
That's when you're almost down.
I was almost down.
So what happens?
You're like, just give it a sec.
Yeah. What happens between these two zones is no longer can your body take in any more oxygen and use it to oxidize the glucose. So glycolysis almost shuts off. And then you have adenosine triphosphate, which is allowing the muscles to contract. You have a storage of 80 to 100 grams, but that really only allows you to produce force for about 5 seconds. Right. That's when you're like, if you watch those cyclists on those hill climbs, that's why it's so impressive, is because they can exceed because they've trained and they have those stores that are greater because they train in that area to where they can hit that hill. But that's when you start to see where like their legs are going fast at first, and then it starts to slow down.
It's like the Versa climber behind us.
Yep.
I mean, you can put me on that for 30 seconds.
You go from here to here. In
15 seconds, I'm cranking. I get to 20. So by the time 30 seconds, you're like, come on, I'm almost at a full stop. 30 seconds.
Yeah.
It's wild.
Yep.
And you watch these UFC fighters that are training, they do like 5 rounds of that or whatever. They're just going that and 5 other things and back to nonstop.
Yeah.
Wild.
They do that straight onto the sled, and then a multitude of other movements and striking things and moving around and just staying active for those 5 minutes to replicate what you would do in a fight.
So we touch on a couple things that we're talking about so much. We're hitting a lot of my questions as we're talking, but we talked about getting started. So first thing, nobody watching this should just jump into any of this if they haven't been to a doctor, if they're just like starting from scratch, right? They need to consult and make sure that they're going to be okay.
Yeah, I would at least first.
We're not giving medical advice here. We're just saying check with somebody just to make sure it's good for you.
Yeah, I would at least first consult with either your primary care physician or if you have a cardiologist.
For sure.
Wouldn't be a bad idea.
Then they give you the thumbs up.
Yeah.
And then jump right into it. So get a watch, get a band. They don't cost much. I have one that also goes around your chest.
Yeah.
I think I paid $50 for it or something. Holder's
a big one. Yeah.
I've tested to see if they both give me the same number, and they do.
Yeah.
Like I've had them both on, and they're almost exactly the same, so they both work. And then get yourself into zone 2. Find out what zone 2 is for yourself. Experiment. And then to your point, when you're there, you'll begin to even recognize the feeling.
Yes.
And you can check your watch every so often, but you'll just know you're there.
Yeah, you can.
And then stay there for an hour.
Yeah.
Half hour is good, but stay there for an hour.
Yeah, that's one of the.
If you really want results.
Yeah, that's one of the reasons why I'll strength train first. But after I strength train, I'll get on the spin bike outside.
Yep.
But I'm not trying to kill myself. I just keep my legs moving to where I maintain that zone 2 endurance for that period of time. I think 30 minutes is typically what I do. But that just helps to further emphasize the fat loss as well. So
you touched on it before, and I think because we're talking about all these different levels of exercise, even though this is about the secret and it's about zone 2, anybody watching this like could literally just got an education.
Yeah.
And it was simple. It was presented in a simple way. So I feel like we did a service in this conversation, but it is possible for somebody who's not frequently active to actually injure themselves, even in zone 2. Because they're just so sedentary.
Yeah.
This is your sweet spot because you're a doctor of physical therapy.
Yeah.
And you see people that are super active, but you must see people that come in who aren't active at all. They decide they're going to go walk on a treadmill or go play tennis and they tear an Achilles.
Yeah.
What should somebody like really, without being a hypochondriac, what should they really be thinking about and like looking for to make sure they really don't get hurt?
Things that I would suggest if somebody were to come in that state that hasn't been active in 5 to 10 years, which I've had before, and they want to start a program, what I would say is start small and be consistent with yourself. Set up a program and stay accountable. Like just continue on with that and you'll slowly see that progression as well. It's going to start slower at first, but the gains will be exponential to where you will start to notice that your body's feeling a little bit better. Your heart might be reacting better to things that normally if you go up a flight of stairs, you're out of breath. Like you might notice that you can handle that a little bit better. You might be able to go up and down like on a couch, like easier, just small things like that. Where I've had a patient where she increased, this is the education I gave her. She increased her steps per day from 5,000 to 10,000.
That's awesome.
I told her that. I said, that's amazing. Like, I love that. She ended up pulling her hamstring because she wasn't used to that. I always use the analogy, if I could squat 300 pounds, and that'd be like me going in the next day and squatting 600 pounds. It sounds like that's unreasonable.
You're guaranteed you're in trouble.
Yeah. So I always, like I told her, I said, instead of going 5 to 10,000, once we heal this up, which she did better after a few weeks, and I educated her on how to load the tissue a little bit more appropriately so as she doesn't injure herself again. Instead of doing 5 to 10,000 steps, I love the mindset, but let's go 5 to 6,000 steps or 5 to 5.5.
Stick there for a while, adapt.
And then slowly, the SAID principle, I don't know if we have explained.
What was it called?
The SAID, SAID.
What does that mean?
Specific adaptations to an imposed demand. So whatever type of adaptation you would like, you then give your body that imposed demand and allow yourself to use that and feel it. I always joke with my patients that, like, I started playing guitar, like, recently again. I picked it back up about a month ago, and the first night I could play for about 15 minutes, and it felt like my fingers were going to fall off. And now I can play for about 3 or 4 hours if I really wanted to. And I have calluses now. The skin's actually gotten tougher, but I gave my body a demand that it needed to adapt to, and it did. Same thing with bone density, same thing with muscle growth, same thing with tendon health. You have to not surpass your threshold with a stimulus, but you want to get to that threshold and then slowly get here.
That's right.
Yeah.
That's right.
That's a healthy way of doing it.
So, final thought.
Yeah.
So we touched on all 5 zones. We touched on the fun of going into 5 and 6 and how it almost causes you to pass out. We have a dog that just walked out to pick him up.
Cooper, I'll pick him up. Cooper. Oh, this is Cooper Sampson. Yeah, this is Cooper.
He's in zone 1 right now. Very chill.
He might even be in zone 2. He gets excited.
We talked about zone 1, zone 2. And so clearly zone 2 is fat burning.
Yeah.
Be there for an hour if you can, half hour minimum. Try to do it 4 or 5 days a week. Eat healthy, and you should see a result. That's really fun. What's final takeaway?
My final takeaway would be just to increase your general health. Try to just become active any way you can, and create a regimen, and just keep yourself accountable. It's gonna help you in the long run.
Don't give up.
Don't give up. Yeah.
Be persistent.
Yeah.
Stick with it.
Mm-hmm.
These are things you're making me think as you're saying.
Yeah. You'll see the gains in the long term, and you'll be happy about it.
I'm not laughing at you. I'm laughing at the dog. This is great, and we're not going to cut this out because this is probably the best part of the show.
Yeah. I love it.
I want to thank you. This was fun. This is the first time we did this.
Yeah.
It was like just we were getting to know each other, and it was like all about your background, which is phenomenal. That's a great story.
Yeah.
Actually, we're going to put a little tag that pops out so people can go back and watch that one to get to know you more. But this is super valuable.
Yeah.
You know, it's like everybody's number one thing is how do I get rid of body fat? Well, this is it. This is the answer.
This is literally
get off your butt and get in zone 2.
And the longer that you
can stop eating so much junk.
Yeah. The longer that you can stay there and you eat healthy, that's really the secret. And it's something that we've done as humans for a long time. We've just gotten used to things being easy, delivery, DoorDash,
100%. Oh my God.
Uber Eats.
My kids order ice cream last night for delivery. I'm like, what?
Yeah.
All right, Dr. Joe, which one is you? Whichever one is you.
Yeah.
How can people reach you? Where are you located? Email. What do you want people to know?
Yeah.
And what's your specialty?
Yeah. So I'm Dr. Joe Sobucki with some problems, blah, blah, blah. I'm going to start that over.
No, it's perfect.
So I'm Dr. Joe Sobucki from Sobucki Physical Therapy. You can find me in Boca Raton, Florida in the Institute of Human Performance. You can reach me at an Instagram handle, which is Dr. Joe Sobucki, all one word. Also, my cell phone number is the one that I use for my business. It's 814-897-6136. And also, you can reach me on Facebook if you really want, but those first 2 would be the easiest ways.
Awesome. Anything that we do need to put in the description, we will. Your website, we're going to put everything there. It'll be there forever as long as the channel's up.
Yep.
And thanks again. Yeah. It's a good conversation.
Awesome.
All right.
Yeah.
Now let's go to zone 5.
Yeah.